first of all, thanks Ajanta for giving me this opportunity. What I'm going to talk, I'm just sharing my screen, and can you see my screen now? Am I audible? So what I'm going to talk to all of you related telemedicine, and that too during and after COVID, which is very, very important because this pandemic had really changed the world. Probably in future, we'll be talking like before COVID and after COVID. It is like becoming like BC on AC, almost like that. And I think telemedicine or a consultation on a virtual platform will become reality. What's the definition of telemedicine, which is very important, and how WHO has defined it? Telemedicine is actually a healing at a distance. I mean, we are trying to do a physically distanced person also and giving him a medicine. And why we are giving the medicine is the primary purpose to heal someone. So the delivery of healthcare services where distance is a critical factor. So person is not physically present in front of the doctor by all healthcare professionals. Now they are using information and a communication technology for the exchange of valid information for what? For diagnosis, for treatment, for prevention, for disease of injury, even for research and for evaluation also, and for the continuation of education of healthcare providers. So even what we are doing today, every day we are doing the webinar, that's also a part of telemedicine in a broad way by WHO, and all in the interest of advancing the health of individuals and their communities. So I mean, ultimately the idea of this telemedicine is to provide this healthcare or for the treatment, diagnosis or prevention of disease, even for research, evaluation, or even providing a continuous education to the healthcare provider is a part of this telemedicine. But very interesting, is it new? No, actually the rise of telemedicine was long back, and in 1924 the first idea of telemedicine was there. And what we are seeing today, it was at that point of time a issue of radio news magazine. The magazine depicted using television and microphone for a patient to communicate with a doctor. And what they had used at that time, including the use of heartbeat and temperature indicators, and they used to send these two information through this television and microphone. So that was the time. So long back, this history and origin of telemedicine was there. But over a period of time, there was so many ethical, legal aspects, multiple things. And during this COVID, we could understand the importance of telemedicine is very, very high. And that's what I'm going to discuss. The definition of telehealth. The New England Journal of Medicine, Catalyst, defines that telehealth is a delivery and facilitation of health and health-related services, including medical care, provider and patient education, health information services, and self-care via telecommunication and digital communication technology. Telemedicine is used to denote clinical services which are delivered by a registered medical practitioner, while telehealth is a broader term of use of technology for health and health-related services, including telemedicines. The application of this, the telemedicine tool suitable for carrying out technology-based patient consultation. So how we do it, it could be simple telephone, it can be a video consultation. Devices are there dedicated, which are connected with LAN or WAN, which is with internet, with mobile, with landline phones. There are chat platforms from WhatsApp, which what we are using, even the WeChat or many more such chat form like Telegram, Facebook Messenger, even the mobile apps or internet-based some digital platform which are there in our country, or even a data transmission system like Skype, and while using the email or fax. So, I mean, different type of tool which are technology-based tools which are available to the doctors as well as for patients, and they can communicate through these different platforms, irrespective of the tool of communication. So, I mean, by whatever the way the communication is done, the core principle remains same. So, I mean, The communication is not important whether we are doing by which platform, but the core principle is remaining the same, that we are giving the information, we are giving service, we are giving treatment to the person who is not sitting in front of you. You are giving completely a person who is far away from you. The telemedicine application can be classified basically in 4 types according to the mode of communication. Timing of the information transmitted is very important. So real time, or they are not at the same time. The purpose of the consultation and the interaction between the individual involved. So we divide it into 4 basic types. The one is according to the mode of communication. So I mean, we can say that yes, what are that? It could be video, it could be audio, it could be text message. So, or it could be even asynchronous, where email or fax is also coming. And this type of mode of communication we are using almost since last 10 years in our country also, because many of our patients, they are calling us on telephone. Before that, they were text messaging. Now they are doing WhatsApp, on even Facebook Messenger. And before that, even we used to get the fax also from our patients. So, I mean, a mode of communication is through this method. On that, we are dividing on what mode of communication person is talking to us. The second very important is according to timing of information. So timing of information means the person is talking real time. At the same time, you are talking and you are giving the information also. You are getting one side the person's information, and we are giving and writing or telling the patient to write a medication either on phone or on video consultation or on text message. But that's real time. That's exchange of relevant information, whether it's for diagnosis, whether it's for medication, whether it's in education or counseling, but everything is done real time. The other way that we are doing this information, we get it, all reports, emails, laboratory reports, radiological investigation, all reports are forwarded to different parties by at any point of time. And they are assessed by the doctor as per their convenience, as per their need. And then again, the answer is given by that. And that also we are doing that. Some patient just they write a message or text message, and then we write the answer to them later on. So that's a one different way, the timing of information. On that also we can divide the telemedicine also according to the purpose of the consultation. So now what is the purpose? One is if person is consulting the first time, and the second purpose is the follow-up. So I mean, you are getting somebody who is not your regular person patient. You don't know any history about that, and it is the first time consulting. So in the first time consulting, definitely it is going to take a lot of time, just not only taking history, then to come to some diagnosis, some clinical diagnosis, getting some investigation. Again, you may call back to the patient. There is a treatment comes in between, and there is a lot of education and health education and counseling is done. And that is what the first counseling, the purpose of that first consulting that is going to take. But when you talk of the follow-up, in follow-up consult, the same patients is giving his all information, and doctors is also having all his information through his electronic medical records, and he may use this service for the just follow-up consultation, or some ongoing treatment is going on just to refill the treatment, or in between any complaint is having patients, or just to want to ask any drug related side effects. So that is the use of first time consultation versus follow-up. The very important, is it immediate or emergency consultation? So whenever we have any phone call or on this, the first thing I think we should ask that if it is an emergency, there cannot be a telemedicine consultation. Rather than this patient is to be advised to reach to the hospital as early as possible. That is what we are doing. According to individuals involved. Now, this is like a patient to RMP, a caregiver to RMP, a RMP to RMP, or a healthcare workers to RMP. So the fourth classification which we have done, suppose a telemedicine is going on between a patient to a registered medical practitioner, or here instead of patient, there is a caregiver who is talking to the registered medical practitioner. The third possibility is that the telemedicine is between a registered medical practitioner who is seeing patient maybe physically, but he is talking to other registered medical practitioner who may be the senior consultant, who may be the specialist, and the telemedicine consultation is going between the two doctors. There is a possibility that a healthcare worker is not the doctor, but maybe a nursing staff, maybe associate assistant who is directly in touch with the patients, and he is doing consulting with registered medical practitioner. So these are the 4 ways in which we can classify the telemedicine applications on what way we are doing. Is it the real time? Is it the purpose of the consultation, first time, follow-up, or in emergency? Or it is between who are involved in this telemedicine application. What the technology used? As I told you, the common technology, which are the 3 modes, which is video, audio, and text message. They are very commonly used, and nowadays even the text message we are seeing since long. But this video and audio consulting, or also we are doing through some other platforms, not necessarily directly from our phone. Also, that could be using your own electronic medical record system, and whatever the digital platform which we are using, we can have direct access of all our patients directly through that system, and we can communicate to our patients, or even they can do the chat and message or email and fax also. Each one of these technology systems has their respective strength, weakness, in context in which they may be appropriate or inadequate to deliver a proper diagnosis. And I think that will be a topic of discussion, because while discussion we will understand that which is better, or each have some advantage and some disadvantage also. Let me talk about strength and limitation of a video consultation. It is closest to in-person consultation with real-time interaction. So what I found, because in last couple of weeks, I started doing video consultation too. And what I found, when it's look like that you are not having physically patient who is in front of you, but at least you can see the patient. So there is a more, contact is there in compared to definitely more contact in compared to on phone. Patient, you feel that you are in touch with the patients. Patient also feel the doctor is sitting in front of you, even maybe on screen. The RMP can see the patients and discuss with the caregiver directly on the same. It's like what we are doing consulting in our clinic, when there is a caregiver, relative, and patient, all 3 are sitting. Here also on the same screen, you find that patient and patient relatives are sitting, or caregiver is sitting. There could be few things which can be inspected through this video consultation also, or you can ask the patient to show some parts of that, and at least you can do the inspection part. May not do the palpation or the auscultation part, but at least by inspection some of the diagnosis can be made also, a clinical diagnosis. The limitation is, one of the biggest limitation is, it's a high quality internet connection, which is improving day by day, and now I can say reasonably we have a high quality internet connection now. There is a possibility of abuse or misuse, because the ensuring privacy of patients in video consultants is very important, because there is a possibility of some misuse of direct video consulting, because you are having the photographs also. What is audio? Again, the audio could be through phone, through this VoIP, or it could be through apps, because there are multiple applications which are available through which we can do the audio consultation. It's really convenient. It is very fast, unlimited reach, suitable for urgent cases. I mean, you have not to talk, take an appointment. Is somebody just picking up the phone and talking to the doctor, or talking to the hospital emergency number. No separate infrastructure required. Even you can use your electronic medical record system or your digital platform through which you can also do the audio call. It is a real-time interaction, and privacy is more ensured in compared to the video consultation. But non-verbal cues may be missed, because you are not emotionally, you can't see the patients, how he is having the issue. Not suitable for condition that require visual interaction, visual connection also. Like some of the examination, the inspection part, you are completely lost here. Patient identification needs to be clearer. And there is a possibility, a greater chance of imposter representing the real patient. So you are not knowing that whether you are talking to the patients only, or sometimes a caregiver might be talking to you that he is a patient. So that's some difficulties there. What about the different type of chats? Can be they used in a telemedicine? Yes, because one of the biggest strength for these, there is a documentation. There is a identification. That's an integral part of this platform, which I like, because whatever he has SMS, whatever he has mailed you, you have that thing in your system. It is suitable for, again, for urgent cases. But again, as I told you, sometimes you may miss the mail immediately. You might not be seeing SMS. So it's not that suitable like phone call, but still it is relatively urgent. No separate infrastructure required, and it can be again real time, because immediately the answers can be given also. The limitation, because of the touch-based, text-based interaction, it requires more time, and it cannot be sure of identity of the doctor or to the patient. So the other side, there is also a possibility, even the doctor may not be writing it, everything may be written by somebody else. What about the asynchronous? It means the person is at his convenience. He's sending messages, fax, email, or recordings. And these data can be seen by the healthcare professional at his ease, at his convenience. That's the biggest advantage of it. But again, the limitation, it's not a real-time interaction. Just one-way communication is done, because a person is sending the email, fax, or recordings, but whether doctor is going to answer or not, that we don't know. The patient identification is document based. So here there is a more documents which we get. It's purely document based. No verbal cue. So no face, also no video consulting. So you can't do anything on inspection part. And there is always possibility of delay, because person may not answer immediately also. What is the guideline? And guideline, I'm talking from India perspective. The 7 elements are to be considered before any telemedicine consultation. One is context. Why? Identification of a doctor and patient. The third is a mode of communication, by which mode a person is contacting the doctor. The consent of the patient. The type of consultation. Patient, whether you are doing for evaluation or for management. And again, in evaluation, it's a first-time consultation or it's a follow-up. So with these 7 elements which are considered when we are talking of a telemedicine consultation. If you just see the metric, the list group, the mode of consultation by any mean, the nature of consultation may be first or follow-up. You can use all list of medication which you can use, but we cannot use the prohibited or schedule X drug which are there in Drug and Cosmetic Act. The Schedule X, they are not to be used in this telemedicine consultation. What the process? What is the flow chart? Now, if you see, the first patient define, or he decides whether he wants to do the video, audio, or text, which is very commonly. So he himself, first he identify himself that I am so and so patient, whether I am a new to your clinic or first time I am talking to you, or I am in follow-up. If he is a patient of a follow-up, he can send his past report or past prescription also. On audio also, he can just tell the doctor who is he, and in message also he can do. So the here consent is implied because patient is asking for a consultation. The quickly assess if emergency care is required. So as a doctor, the first thing he has to understand that this is not an emergency. So he should not waste minutes on understanding this. He has to quickly understand and quickly assess that this is not an emergency. If it's an emergency, please tell the patient to go to immediate relief and get hospitalized or go to the hospital emergency care. If it is not, then try to get the maximum or complete patient information, which you may have if you are using an electronic medical record system properly and it's your patient is follow-up. Otherwise, you take the history properly, what the reports past or present investigation, that patient can send you in advance also. If you want some other additional information, patient can get you the other information, and that you can again talk to that. And RMP may choose the mode of communication. Suppose a patient is writing you a text message, but doctor, after talking to him, or it becomes very inconvenient for him and he wants to know, I want audio consultation, and he can call the patient or tell the patient to call me. Or he feels that I need some sort of inspection, then he can tell the patient that I want a video consultation also. Is the case is appropriate? Now, this is very important. And again, it is doctor who has to identify that whether I am dealing with an appropriate case. Once I told you it's an emergency, send to that. But still, even there are some patients who require good clinical diagnosis and they require a lot of examination also. So a doctor has to confirm that he is seeing an appropriate case, which can be done. The management can be done through telemedicine. So the management here will be health education, counseling, and specific treatment. And normally this is in 3 stages what we are doing, and we are consulting our patient. First, if it's a follow-up patient, he knows what education which we had given to him, but still we can follow him on related to education part. Second part is counseling, and then you can go to the specific treatment. If is not the case for a appropriate consultation, I think they may require more of education, or sometimes they require a in-person consultation. That's not necessarily that they can be consulted only on telecommunication also. The other is flow chart for that. As I told you, first he is identified, he himself. The person should be reasonably convinced that he is communicating with the known patient. So if a doctor, if he is seeing the follow-up patient, he should identify or should realize that he is seeing so-and-so patient, either through his data or whatever he remembers. If not, he can request the patient to re-initiate a conversation with registered phone number, patient identity, by asking patient age, address, email ID, and phone number. So if he is not able to recognize, no, I am not able to recognize the patient, he can again ask that, who are you? Quickly assess, again, the consultation. You have to divide between emergency and non-emergency. That's very, very important part of it. Is the case appropriate? Again, as I told you, if it's a new complaint, then it's like a first consultation. But if it is an older complaint and we are talking only from diabetes perspective, a patient may be of 5 years and 10 years, but he may have some new complaints also. Why today he is talking to you? Maybe because of fever, maybe because of urinary tract problem, because of some other issue, maybe he having some chest pain, some breathlessness, edema in feet. So that's very important. The new complaint we must understand, and whether that can be tackled on telemedicine or not. Otherwise, again, patient may require health education and in-person consultation too. For a health worker, there is a possibility that patient is talking to health worker who seeks the consult for the patient. So I mean, the patient himself is not talking to the doctor, but it's a healthcare provider. Or you can see somebody who is a caretaker for the patients. Even they can talk directly to the doctor after identifying himself as well as for the patient. And there are RMP and doctors who are talking to the other consultant after giving the identification for particular patients, and then they flow in the same way and the management is done on the same aspect. The common type of counter medication, such as over-the-counter medication like antipyretic, which is available, the cough supplements which are available, the ORS packets, zinc syrup, supplementation like iron folic acid, medication which is notified by Government of India like chloroquine for anti-malaria. There are some list A which are first consultation medication like ointments, lotions, local ophthalmological drops, local ear drops, and follow-up consultation for above medication too. The follow-up medication for any chronic illness as a refill, it can be done. So I mean, you have a patient like hypertension, diabetes, asthma, or some patients with have all complications of diabetes, or they have, the follow-up can be done on 1 or 2 months basis, and they can be have refill for that. On follow-up, medication prescribed on add-on ongoing chronic medication to optimize management, such as the registered medical practitioner name. This will come in this form. Now, very important, during this CV, I mean, this COVID pandemic, how we are going to do the telemedicine. So one part which I talked about, the what exactly the telemedicine, what different ways of telemedicine, and I'm sure all of us were doing telemedicine in one form or other form. But during this COVID, when everything is 100% become the virtual, and we should not meet the patients unless he is having emergency, and once he is having emergency, patient is to be shifted to the hospital only directly. So what American College of Cardiology, one very important prior to telehealth visit, the fellow review the patient chart, previous imaging, test result, and that determines a plan of care. How would a fellow approach this patient if he is seeing the patient alone? The fellow then discuss the plan and relevant imaging, then attending prior to contacting the patient. So first and foremost thing, before even a teleconsultation is made, he has to understand for what and what are the reports patient had already done. Then a medical assistant or a nurse gets the call to understand what is the problem. He or she reviews the medication, reconciliation, vitals are taken by patient at home, and all data are transferred. That's the second best step. Then a telephone visit can be a three-way conference call. That is what the call patient shortly, adding the attending into the conference call. Anyone that is added into the proximity call would be able to see the caller's cell phone number. Also, for our pulmonary hypertension patient, we also able to add a pulmonary hypertension nurse. There are many ways of doing this joint call. An alternative, a fellow can tell the patients, and once this joint call is there, the whoever is fellow who is taking care, he can ultimately deliver even the healthcare education to the patients also. For video visits, the different video platforms are there, and a fellow and attending can meet on a consultation room for a combined video call, or they can have a added video of being able to see the patients individually also. And documentation, which is very important from an American perspective, that it is to be completed by fellow. And then I will be talking in India also what we are doing and what we should do. What WHO is standing for this as a telemedicine. Consider using telemedicine to evaluate suspected case of COVID, thus minimizing the need for these persons to go to healthcare facility for people. And that is what we are doing just now. We are helping our patients on telemedicine just because we don't want our patients should move here to there during this COVID crisis. And this is what we are doing, and it should be available. Our telehealth or telemedicine facility should be available to all patients who are suffering from diabetes, at least from my perspective, across the country. What United States Department of Health and Human Service, that is US FDA, and they had also given the notification because of this nationwide public health emergency. So there was a time in US and Europe, some of the countries, and they never used to have a telemedicine. Medicine cannot be refilled, but during this period of time, they are allowing that also. What Indian governments, through the Board of Governors of Member Council of Medical Council of India, they are saying enable registered medical practitioner to provide healthcare using telemedicine. And this constitutes 5 of Indian Medical Council and a professional conduct. On a 25th March 2020, this you must download if you don't have. Ministry of Health and Family Welfare, Government of India, or even a telemedicine PDF is also available. Now, being a diabetologist, as I am practicing diabetes, this actually telemedicine or digitalization of diabetes care, and during this COVID period, I think this digital clinic or digital consulting or e-consulting with my patient is really helping patient and provider burden. That's very, very important, because otherwise he was having so much burden that patient has to travel from different parts of the city or different parts of the state just to meet the doctor. The second, it is really the barrier of geography is going on. Now that had gone, because now today I am consulting. Day before yesterday I had consulted 3 NRI. Today morning I have consulted 1 NRI patient. She was my patient only, and today we talk to the patient. So I mean, geographical barriers are completely out. The therapeutic decision making can also be done, because that we were doing actually when you are writing a prescription to patients. There is most of the time it's not necessarily that the patient will the same medication, the patient sugar will be well controlled. But that decision you can take after talking to the patients on phone, on a video consulting, and you can change minor or major. Some medication can be changed. It also helps us to reduce the patient hypoglycemia also. There are patients who are not in position to frequently to be monitored by a healthcare professional or maybe senior doctor. So they can be in touch through other healthcare professional, through primary care physician, directly to the doctors also. That helps. And there could be less frequently contacts he can do with the senior doctor, while he can maintain his contact with the junior doctors too. So it will reduce the cost burden also. We know that in India, the monitoring or the data is not proper. We are writing, many of us are using the electronic medical records, but still, unless our patients are completely digitalized and we get the data through monitoring system, and then we can, push it in our computer, then this data will be completed. And ultimately, there is a poor outcome in the patients who are having diabetes and they are not regularly monitoring, or they are not going to the doctors regularly. So digitalization, particularly in diabetes, has excellent potential to collect data more seamlessly, make collected data more useful, and drive better outcome at lower cost in less time. And that is the biggest advantage of this digital clinic. I had just, because we are making also one guideline from RSSDI, is I'm the president of RSSDI, that how you can, in a diabetic patients, you can do the consulting, whether it's a type 1 or type 2 patients. From the glucose monitor, we can put all the data can be collected. Patient weight can be measured at home, blood pressure can be measured at home, his symptoms can be measured at home. He can ask, he can call the patients, and then we can come with some clinical recommendation or some therapy adjustment which can be done only on telemedicine. To conclude my talk, that telemedicine provides opportunity to judiciously manage patients during this lockdown period of COVID-19 epidemic, except few instances where face-to-face consultation or hospitalization is real needed. Otherwise, we can finish 80 or 90% of the patients. What we are doing since last 4 weeks, the more data required to research effectiveness of telemedicine to manage chronic disease in India. And for that, I think more publication will come in coming years also. I'll be very, very happy if you have any questions related to this, or even comments, what we can do or we can discuss with the patient. So I have some comments and questions which had come to me. I'll be answering those. Dr. Parasroy from Surat. So one Dr. Parasroy from Surat is asking, does it suitable for new patient? As I told you, the consulting can be done. In a diabetic patients also, only thing is that maybe you may require 2 or 3 consulting, because in a new consulting, you require a full history, complete history properly, then his medication history, all his investigation last 3-4 years, all data should come to you. And that's the only way by which you can use this software or telemedicine platform for using a new patient also. How you find the practice your patient's level of satisfaction? I fully agree that patient satisfaction at this point of time will be very less. But during COVID pandemic, they are also understanding that doctors will not able to see them. But at least we are giving them service, and we are talking to our patients. And for follow-up patients, I am quite satisfied. Not only my patient satisfied, I am me too. But for the new case, it's real difficulty. I agree with you. How do you incorporate other service like dietitian service? And this is very important and very pertinent question, because what as a doctor can do is only related to the therapy. But we have some apps which are related to the diets. We have some apps which are related to education. We have some apps which are related to motivation. And I am working with them. I am working with them at national level also from RSSDA, that how we can use, and these applications which I am giving to my patients. Even before COVID also, I used to write these application to my patients too. Sir, I am from one doctor unable to connect, ask question, should we keep records of consultation? If yes, then duration. Now, telemedicine at present, we don't have any legal or reason that you should keep the records of the patients. But yes, all those platforms which we are using, like which are written, like a patient is putting you on mail or Facebook Messenger or on your WhatsApp, you have the records. At least you are talking to the patients. On phone, sometimes it's not there. But that is the reason now we have started using definitely dedicated telemedicine software, which can be connected through your electronic medical records. And then, whatever consulting which we have done with the patient, it remains also in our records also. How can you use telemedicine after COVID? As I told you, the after COVID, again, the situation will be very difficult. You don't know this COVID will continue how long. It's nothing like after COVID. It's maybe 2 years or 3 years down the line. So maybe once this lockdown period will go away, we will be consulting our patients, and we will try that more and more consulting can be done through telemedicine. The same way what we are going to use. But if patients wants to come to clinic and you also want that I must see the patient, then I think few more questions you have to ask regarding his infection part, his throat, coughing, other infection related, exposure history, travel history, all those questions. And if you find that there is a suspicion that patient may have COVID positivity, a patient may not be seen by the consultant, straightway he can be referred to the hospital. Even in hospitals also, we have a dedicated flu clinic or dedicated fever clinic or dedicated cough clinic. So patient has to come through that clinic only. So once he will be screened by a doctor, primary care physician, that this patients may require a diabetes consultation. After that, he does not have any other issue related to the infection, then and then he can be asked that to go and see the doctor. We can prescribe the pregabalin, yes, definitely on telemedicine, but may not be like lorazepam or something like that. Aspirin, definitely for non-acute MI, aspirin also, which we are giving to many of our patients. Medical legal aspect, as I already told, it's very clear now. We had come out with the ICMR guideline also, that it is medical legally proof. Consultation also we can take, and that consultation we can use through that platform, and it is also official.
Limitation of fees.
There is no limitation of fees. Again, as you know, the different doctors are charging differently in their OPD, the same way they can charge in telemedicine consultation also. So somebody asked that where we should be cautious. Wherever you feel that this patient is having some emergency. I am using all my patients who are during this period, diabetic foot patients, we all the time we do video consulting only. We don't really only on phone. And we see that whether there is a problem, some of the patients I had to call to my clinic and some of the patients I had to admit also. Tips for diabetes specialist. For a teleconsultation, one very important tip for diabetes consultation to all diabetologists, we should start using teleconsultation more and more. That's the number one advice. The second, you may use, yes, by Pratap, and more they should use it, this teleconsultation in their practice. And in future also, we should use this platform, maybe through your electronic medical record system or by any other way, we should use. And at the same time, you don't forget that you are giving all education and all the answers of their concern through this platform. But at the same time, if you find that they have some issue which is to be tackled emergently, then either they should be called to your hospital or to the hospital where emergency services are available. So somebody is asking certain app in telemedicine. So at present, I am using like HealthPlex, which is the software which we are using. Some of them are using One Glance. Some of them are using doctors, onlinedoctors.com. So there are many apps which are available to the patients and to the doctors also in India. And some of them are supported by some of the newcomers in India. What about hypertension patient? The best way is that if patient should have a self-monitoring of hypertension. And then we can follow up these patients with hypertension. Also, the similar way what we are doing for the diabetic patients. If we have any other question, I'll be more than happy. Otherwise, we can stop or I give to the organizer, Vasan Bhai, Chetan.